Pharmacology nursing students, let's talk all about loop diuretics. If you have a specific medication you want me to make a video for, in the comments. Loop diuretics. These drugs play a critical role in managing fluid overload and blood pressure. Let's break it down so you can ace this on your next exam. First, let's talk about what loop diuretics are and how they work. Loop diuretics are potent diuretics that work in the loop of Henle of the kidney. They block sodium and chloride reabsorption, pulling water along with them. The result is a lot of urine output and a drop in fluid volume and blood pressure. These are some common loop diuretics, and hint, they end in mide or nide to help you recognize them on an exam. NCLEX tip, furosemide is the one I see most common. Why do we give loop diuretics? These meds are given when patients are holding on to too much fluid or have dangerously high blood pressure. Think of them as your go-to medication for fluid overload. We typically see them in conditions like heart failure. This is going to reduce fluid overload, decreasing strain on the heart. You can use them for pulmonary edema, which helps patients breathe easier by reducing that lung congestion. Hypertension is another common one. This is going to lower blood pressure by reducing blood volume. Kidney disease is another one that we see. This helps clear excess fluid in patients with reduced kidney function. And you can actually use them for liver cirrhosis and ascites. This decreases that fluid buildup in the abdomen that you see with this condition. Side effects and nursing considerations. Well, loop diuretics work fast and they are strong, but that means they come with some serious side effects. Here's what you need to watch for. First is a big one, electrolyte imbalances. Think hypo everything. This is a potassium wasting diuretic, so the first off is hypokalemia. This is low potassium. Watch for muscle cramps, weakness, and irregular heartbeats. The next one is hypomagnesium. It can lead to tremors, seizures, and increased risk for arrhythmias. Hyponatremia is low sodium. Remember, where sodium goes, water follows. So if we're getting rid of water, we're also getting rid of sodium. This can cause confusion, seizures, and even coma. Dehydration and hypotension. These meds pull a lot of water off the patient, so patients can get dizzy, weak, or pass out, which is why it brings me to my next one. You need to monitor blood pressure before and after. Hold the medication if your systolic blood pressure is less than 90. These medications can interestingly also cause ototoxicity, which is hearing damage. High doses of furosemide given too fast IV can cause tinnitus or ringing in the ears, and could even lead to permanent hearing loss. Here's your nursing tip. Give IV push slowly over 1 to 2 minutes per 20 milligrams. Loop diuretics can also increase blood sugar and cause hyperglycemia and can increase uric acid, leading to a risk for gout. So be cautious of your patients who have history of gout and diabetics. Here's an allergy warning. Most loop diuretics contain sulfa, so watch for allergic reactions. Ask your patient about a history of sulfa allergy. Some nursing responsibilities and patient education you want to know is one, to monitor daily weights. Both as the nurse and the patient needs to do this when they go home. This is the best indicator of fluid status. A gain or loss of 2 or more pounds overnight, they need to call their provider. Take strict I's and O's. Ensure urine output is increasing. If not, the kidneys may be shutting down. Watch for dehydration. This is going to mean you might see dark urine or dry mucous membranes. And again, this is a potassium wasting drug. Low potassium can lead to a risk of deadly arrhythmias. Patients may need potassium supplements or a potassium sparing diuretic like spironolactone. Again, as the nurse and when the patient goes home, we're going to be monitoring blood pressure. The risk of hypotension is a real concern. Hold the medication if the systolic blood pressure is less than 90. Educate your patients to take this medication in the morning. It's going to help them avoid waking up at night to pee every hour. Eat potassium-rich foods like bananas, oranges, spinach, and potato. Remember that risk of ototoxicity? Tell your patients to report any ringing in the ears. And avoid NSAIDs like ibuprofen and naproxen. This can actually reduce the effectiveness of diuretic. Thanks for making it to the end. Tag a fellow nurse who needs this refresher, and like, share, and follow for more pharmacology tips.